Good evening, everyone, and thank you once again for joining me for another live tonight. This live, I've decided to talk about protecting your pelvic floor, and this is a topic of incredible importance for all women who are pregnant or postpartum. We know that about 30 to 40% of women are estimated to have some form of bladder or bowel issues during pregnancy and after giving birth. And tonight I thought it would be brilliant to talk to someone who is an absolute expert in this field. And I'm very lucky that I will be joined tonight by Jess Costos, who is a physiotherapist and Pilates instructor who has additional qualifications in pelvic floor physiotherapy. So tonight Jess is going to talk us through what the pelvic floor is, the importance of understanding it, and what you can do as a woman who is either trying to conceive, pregnant, or with a newborn to protect your pelvic floor both in the short and long term. So I'm going to get Jess to join us now, and very much look forward to hear what she's got to say tonight.
Oh, here we go.
Hi,
Hi,
Jess.
Scott.
How are you?
Good. How are you?
I'm very well. Thank you so much for joining me tonight. I really appreciate it.
Thank you. I was really looking forward to our chat tonight.
Excellent. Me too. I apologise for the fact I'm a little bit red on the screen. I spent an hour outside for the first time in quite a while, and I think I forgot about the Melbourne sun. So I
It was actually
apologise.
really nice outside today,
It
wasn't
was a
it?
beautiful day. It was actually nice to get some sun, but I think I'm paying for the effects of it now. But I'm so grateful for you joining me tonight. We've got a lot to cover. This is a very, very important topic, and I think that a lot of women feel initially quite uncomfortable talking about it, to be honest with you. But once they realise how important it is, especially when unfortunately a lot of them have trouble with it down the track, then they wish they'd done something about it a little bit sooner. So hopefully tonight, everyone watching can be proactive and get a lot out of what you've got to share with us. And once again, I'm really grateful for you being with me tonight. So what I might get you to start by telling me about is what your job actually is. As a pelvic health physio, what do your consultations involve? Who comes to see you? And obviously, given that I'm an obstetrician, particularly around sort of women who are pregnant and postpartum, what sort of things do you offer and do you do?
Yeah, so I'm a physiotherapist with a special interest in pelvic health physio. So I do treat men and women, but I mostly treat women.
Yep.
Generally, so at the moment I'm working in private practice.
Yep.
Previously I've worked in on a maternity ward in inpatients and outpatients, but
Yep.
at the moment, generally what I'll see is pre-postnatal women for anything pelvic related or pregnancy related. So anything from kind of like your back pain, your pelvic girdle
Yep.
pain,
Yep.
rib pain, etc., but through to pelvic floor things such as leakage,
Yep.
bladder bowels,
Yep.
heaviness, so like
Yep.
prolapse symptoms,
Mm-hmm.
care, like 6-week checks I do quite a
Yep.
lot of.
Great.
And I'll be looking at someone's like pelvic floor, their stomach muscles, like a bit
Yep.
of a musculoskeletal screen, things like that.
Yep.
And I see quite a lot of sexual pain as well.
Yep.
And what else? And Pilates. So I do quite
Great.
a lot of postnatal Pilates. That's like my specialty as well.
Excellent.
Yeah.
And as I say to all of my patients, I think Pilates is probably the best form of exercise that you can do sort of during and after pregnancy. And they get so much out of it, especially when it's being done by an expert like you with, training in the area. It's really wonderful. But I would say, I reckon close to half of my patients end up doing some sort of Pilates either during or after pregnancy. So often really nicely linked in with sort of fitness and health as well. So can you tell us a little bit about what the pelvic floor actually is? I think a lot of people hear the word pelvic floor health spoken about, but they don't actually know what it entails. What is the pelvic floor? Obviously, it's a bit complex to describe because the anatomy of it, even for an obstetrician, is not the most simple to understand, but how can you sort of break it down for people watching tonight?
Yeah, so I suppose most people come in that have never seen a picture of pelvic floor. They don't know that. They might not have ever heard of it until they've fell pregnant.
Yeah.
And another interesting thing, men have a pelvic floor too. I think a lot of people aren't aware of that. You would know, obviously.
Yeah.
But, So the pelvic floor is a hammock, and it kind of slings from. I'll stand back so I can kind of show. So it slings
Great.
from your pubic bone here through
Yep.
to your tailbone at the back.
Yep.
So it slings from front to back, and it slings from the pubic bone, slings around the urethra and back, slings around the vagina and back, and then slings to the coccyx around your back passage and back. So what it does is it's underneath your pelvis, and it kind of holds up all your organs from below. And it
Yep.
also has a role in continence. So bladder, bowels, making sure we're not leaking throughout the day, and
Yep.
obviously sexual function as well. Yeah.
Excellent. And when you say it helps, with control of bladder, bowel, sexual health, in what way? What sort of things does it enable us to do?
Yeah. So let's think bladder. So
Yep.
it allows you to hold on throughout the day,
Yep.
so that you can put off an urge and go at an appropriate time,
Yep.
so that you're not leaking with like coughing,
Yep.
sneezing, laughing,
Yep.
things like that. And also in terms of making sure how often you go into the toilet is normal.
Right.
Sometimes I'll see people either end of the spectrum, they might be going quite frequently, or they might be
Yep.
going holding on all day.
Yep.
And if we're talking about bowels, it has a role in terms of making sure you can open your bowels properly so that there's no constipation or straining, but also being able to hold on so that you don't get urgency, or you can kind of get to the toilet at appropriate time, but also holding on to wind as well.
Yeah.
Yeah.
Excellent. In terms of sexual function?
Yeah. So sexual function, so obviously the pelvic floor muscles are around the vaginal opening and up into the vagina. So helping in terms of like orgasms and things like that. And also like with arousal, they respond to the hormones in your body and kind of lengthen as well.
Yeah. Easy. And what is the impact of pregnancy on the pelvic floor? How does it actually affect the pelvic floor? And why is it a time where we need to focus on pelvic health so much?
Yeah. So there's a few different things. So firstly, the weight of the baby and the uterus on the pelvic floor can weaken the pelvic floor.
Yeah.
So as the baby grows, obviously there's people put on such a lot of weight in such a short period of time.
Yes.
And I'll say to my patients, if I handed you a 15-kilo kettlebell suddenly, and then you had to hold it around all day, like you would expect to be really fatigued and weak and feel
Absolutely.
Yeah. So obviously pregnancy itself can weaken it from that. But then there's also the hormonal changes happening in pregnancy. So things like the progesterone kind of softens your intestines and things like that. So what will happen is people might find they have issues with their bowels in terms of like constipation. And so the issues like straining and constipation as well, in addition to the pregnancy, can make the pelvic floor weaker.
Yeah.
I think.
And what happens just to the pelvic floor in labour?
Yeah. Okay. So in labour, as the baby's head comes through, the pelvic floor stretches 300% of its resting length, which is amazing. Yeah. Huge. And so the pelvic floor is designed to stretch, obviously. And, it does go back and everything, but that does inherently weaken the pelvic floor. And then if you throw in other things and variables that can happen in labor, such as, a baby with a bigger head, a baby coming with its hands like this out, instruments, any perineal tears, pushing for an extra extended period of time, things like that, that can kind of add to your risk of having pelvic floor dysfunction.
Definitely. I agree with all of that. And sort of what I want to focus on tonight, and I think the reason that everyone wants to hear what you've got to say primarily, is about what they can do to reduce the risk of pelvic floor damage, to therefore protect their bladder, bowel, sexual function, etc. So obviously pelvic floor exercises form a huge part of that. And I actually want to focus on that very shortly, because I want you to even give us sort of really practical tips as to what women can do. But apart from pelvic floor exercises, what else can women do before, during, and after pregnancy to care for their pelvic health?
Yeah, so Before labor, we recommend doing perineal massage.
Yeah.
Perineal massage is essentially, so the perineum is the skin between your vagina and your back passage. So if
Yeah.
I'm thinking like that's the back of the vagina, it's kind of massaging through this area here. I'll
Yeah.
normally instruct patients to do it from about 35, 36 weeks onwards.
Yeah.
I might be doing it for about 5, 10 minutes a day, a bit more frequently towards their due date.
Yeah.
And that's just to help with like elasticity in the pelvic floor.
Yeah.
I also suggest the NICE guidelines actually recommend that everyone gets their pelvic floor checked by a professional.
Yeah.
We know that 50% of women don't contract their pelvic floor properly. So I suppose the main thing is, because obviously it's not just about contracting your pelvic floor, it's about being able to relax it as well and also having a normal resting tone. So so I think the main thing is, if I'll see someone for back pain or something like that, and in pregnancy, and I'll just say, look, you don't have any pelvic floor issues now, but you'll be kicking yourself if you just did 6 months of pelvic floor exercises and then you found out you actually weren't doing it right. So
Absolutely.
I would definitely recommend getting a pelvic floor assessment just to check doing it right, and that will generally involve an internal examination, or for those who aren't keen for that, we can do real-time ultrasound. It doesn't tell me the strength, but at least I can tell if someone's lifting or bearing down, which is good enough to start with.
Definitely. Yep.
Yeah.
Excellent. And in terms of perineal massage, what is the technique that you encourage your clients to use?
Yeah, so I'll normally get people to use like some type of lubricant or like an olive oil or something like that. And what they'll do is probably the easiest position is sitting on the toilet. The one thing is, like, I'm not pregnant and it's a bit of a struggle to kind of reach that area. So I find like it's kind of hard at 40 weeks pregnant to be reaching around to do it. So sometimes I might get their partner to help out. But either sitting on the toilet or kind of standing with one leg propped on the toilet, and then they'll reach around with their thumb. And like, if this is the perineum, it's kind of firstly just doing like a sweeping from side to side, kind of like stretching out and really just, and also kind of contracting and relaxing as well with it, to use the contract and relax principles to help relax the pelvic floor, but also to have that awareness of when it's on and off. And I'll normally say 5 minutes of that. They might start doing it 2 to 3 times a week, but when they get to about a week from their due date, I tell them to do it every single day.
Excellent. Very consistent with the information that I give my patients as well. I suppose the next thing that a lot of women ask about is, well, in labour, what can they do for perineal protection? I suppose that's my job and the job of my colleagues as well, to make sure that we are helping in whatever way we can. And I think that a lot of women want to know that their obstetrician is focused on protecting their perineum, and it's certainly, I think, one of the most important parts of the delivery. It's all, well and good to make sure that we're delivering a healthy baby, but at the same time, maternal health, both, immediately, but also long-term, are incredibly important. And I think it's critical that as an obstetrician, I spend a lot of time at the delivery focusing on protecting the perineum and the pelvis as well. And the things that I sort of, in my practice, like to make sure is often that there's sort of some degree of warm compress put on the perineum while the perineum's stretching, while the woman's pushing. And a lot of it then really comes down to meticulous control of the head and body as it's delivered. And, you hear of these stories of women just expulsively pushing their babies out quickly, and we know that increases the risk of perineal trauma. And it's very important that no matter what the circumstances, even if you've got a baby that's a little bit distressed, that you just take those few extra seconds or minutes just to make sure that things are controlled, and you allow the perineum to stretch as much as possible. And it's usually never been stretched to that size before, especially with baby number one. So it's important just to give it the time that it needs to stretch, and to assess whether or not you know, you think there is going to be a significant degree of perineal trauma, and to consider, I suppose, an episiotomy if needed. And that shouldn't be routine, in my opinion. It should be very much guided by how each perineum looks as the head is being born. And that's the job of an experienced obstetrician, to make sure that the right decisions are made to best care for the woman. There's a lot of talk also, obviously, about the position that a woman is birthing in, and there are some that have potentially been shown to be better. Some people talk about, you know, being completely flat on the back as being not ideal, because you're putting a lot more pressure potentially through the perineum. But equally, for some deliveries, that's necessary. If you're having a forceps birth, or, you know, a vacuum delivery, sometimes it is safest for mum and baby that I, as the obstetrician, have complete control, and that often does mean that a woman is on her back in lithotomy. But I think it's about the care provider being comfortable with the position, knowing that they can protect the perineum in that position. That's why often I don't like women standing up for birth, because I cannot protect the perineum while a woman is completely standing. I can't see it, and I can't access it properly to make sure that I'm able to control it. But I think that, you know, knowing you've got someone there looking after you who is, you know, making the pelvic floor and the perineum a priority is really important, you know, for pelvic health. And that's certainly something that, as an obstetrician, I take pride in, and I make sure that I do for every woman who's having a vaginal delivery. And I suppose once they've then had birth, often they then come back, you know, or given birth, they come back your way, and perineal care and pelvic sort of care in the postpartum period is just critical as well. What do you advise your patients? We'll leave pelvic floor exercises for a second, because, as I said, we're going to really focus on that shortly. But what other elements of sort of pelvic or perineal care do you recommend for your patients postpartum?
Yeah, so this is kind of the advice that I'll give someone when I see them just before they're about to go. They'll have their like last appointment with me at like 38, 39 weeks. I will say to them, firstly, in terms of their expectations with their pelvic floor, like right now you might be holding it for, you know, 10, 15 seconds. Expect to only be able to, you might not feel anything happen. You might feel like a little bit of a flicker or something. So giving that expectation. And then I will make sure that they are starting their pelvic floor exercises within a few days of giving birth. But not with the intention to kind of really strengthen it, more with the intention to get like little pumps going so that there's a bit of blood flow to the area to help with that neural regeneration and kind of help with any swelling in the area too. I think some people have said to me, you know, oh, if I've got stitches, are the stitches going to come out? But be assured the stitches are very, very secure. They're not going to come out.
Correct. Absolutely.
Yeah. I'll also talk about, you know, sitting positions. So, you know, sitting is quite hard after, as you can imagine. You know, you can get like donut cushions that people might sit on, or you can kind of roll two towels up in logs and then prop one underneath each thigh and sit on that. So there's kind of a bit of a gap in the middle there. And then also, you know, just making sure you're keeping the area dry. So if someone's going to the toilet, they might have a shower. After, just use their little pump bottles, clean the area and pat it dry. I
echo that completely. I say to, you know, women, it's really important to keep it clean every time they've been to the bathroom, either to, you know, use their bladder or their bowels just to wash. And as you said before, accessing the area is very, very difficult. So something like a pump bottle just to squeeze on is really good. But once it's been sort of washed, just to make sure that it's dried well, not to be overly aggressive with any stitches, but just to pat it dry, or even just a warm hairdryer is a very effective way of doing it. And the other thing that I recommend for sort of perineal hygiene are salt baths. And not everyone has the luxury of a bath at home, but for those that do, a bit of salt in a warm bath is a good idea sort of on a daily basis. I agree. I've got a thumbs up from Jack there, who's my midwife, who looks after all of my patients and has this exact discussion with all of them. So, you know, I'm glad that we're giving consistent information as to what an expert like you would recommend, Jess. That's really good. So what I want to move on to now is what a pelvic floor exercise is. And I think that a lot of women hear about pelvic floor exercises and they read about them, but a lot of people aren't actually doing them properly. And what I would love for you to be able to do tonight is to spend, 20 or 25 minutes actually almost giving us a little bit of a class as to what effective pelvic floor exercises are in terms of when they should be done, how often women should be doing them, what particular exercises to employ, should they change the exercises while they're pregnant to then what they're doing postpartum. And I've given you a huge amount here and I'm happy to give you prompts along the way, but just sort of, I want to sort of make the floor yours and let you sort of talk us through effective pelvic floor exercises.
Okay, so I actually did a workshop on this on the weekend, last weekend.
Perfect.
So fresh in my mind.
Great.
So firstly, before I start off, I just want to say that pelvic floor exercises are in the realm of physio, the one thing in physio that has the most evidence and the highest level evidence. There's level 1A evidence for pelvic floor exercises, so everyone should be doing them.
Yeah.
And so firstly, you kind of want to think about where the pelvic floor is.
Yes.
I want everyone who is watching and who's going to watch this later and potentially have a go, I want you to make sure you're sitting up on a chair. And so when you're sitting, you kind of think about your sit bones. So there's two bony bits that your hamstrings attached to. And I want you to be propped up, sitting tall on your sit bones with your chest up tall, your head back over your shoulders. If you're not sure, just give your pelvis a few tilts forward and back, and then come back so you're sitting rested on top of your sit bones, okay? Then I want you to make sure that you're relaxed through the pelvic floor and through your stomach, okay? So firstly, just maybe squeeze your stomach muscle, squeeze your pelvic floor area, or if you don't know what that is, just squeeze everything and then just release it. Keep it relaxed and then put your hands on your belly and take a few big breaths into your belly, just really making sure that when you inhale, that stomach muscles are expanding. If we're thinking about our core is from our diaphragm here to our pelvic floor below, deep stomach muscles, deep back muscles. So if we want our pelvic floor relaxed, our stomach muscles have to be relaxed as well to start with, okay? So keeping everything relaxed. Then what I'm going to do is I'm going to give a few different cues, because what we know is the same cue does not work for everyone. Some people respond better to visual cues or visual imagery and things like that. So firstly, I'm going to get everyone to keep everything relaxed, take a big breath in. And then as you exhale, I'm going to join you. Good. As you exhale, I want you just to think about holding on for wee and squeeze as strong as you can. And then release. Okay, so I'm going to give you a few different cues. I want you now to take note when you're contracting your pelvic floor, whether you're getting any accessory muscles working. So what I don't want to see is your legs or your bottom muscles engaging and squeezing. I don't want the stomach muscles tightening right up the top here. They might tighten a little bit kind of where your underwear line is. I also want to make sure that I can't actually tell someone's doing their pelvic floor exercises. So if I give someone a cue and they're looking at me and they go, when they go to contract, then I know they've definitely done it wrong, okay?
Yep.
So you shouldn't be able to tell, no one should be able to tell I'm doing it except for the fact that I'm explaining, okay?
Yep.
So again, let's keep everything relaxed. Take a big breath in, relax everything. This time as you exhale, I want you to squeeze like you're holding on to wind and squeeze as strong as you can. Holding, and then release. Good. Next cue, take a big breath in. As you exhale, I want you to think about holding on to wind and wee now, and squeeze as strong as you can. Good, and then release. All right, next one. I'm going to explain the anatomy again. So we've got pubic bone, coccyx, and the muscles are like a sling around everything there, okay? Yep. So the next cue, we're going to squeeze, think about the sling, we're squeezing from the back and we're pulling everything forward to the pubic bone, okay? So maybe everyone who's doing it at home, put their hands on their pubic bone. I want you to keep everything relaxed, take a big breath in. And then as you breathe out, squeeze from your back passage and pull it forward to your pubic bone area. And squeeze as strong as you can. and then release. All right, different cue now. So we're going to squeeze from the back passage, but this time, rather than pulling to the pubic bone, we're going to pull halfway between your belly button and your pubic bone. Okay, so you can put your hand on your stomach there. If I'm in rooms with someone, I might put my hand there and palpate.
Yeah.
So you can put your hand there, big breath in, keep everything relaxed to start with. And then as you exhale, squeeze from your back passage, pull to that lower stomach area, hold as strong as you can, and then release. All right, different cue. This is someone I learned from an old colleague in the UK called Wink and Zip. Okay, so I'm going to get everyone to take a big breath in, just relax everything to start with. And then as you breathe out, wink your back passage and zip it to your pubic bone as strong as you can. Good, and then unzip. All right, next one.
You can see how for people that haven't done these before, they're, you know, muscles that you probably don't feel like you're using particularly often consciously, aren't they?
Yes, yeah, exactly right. And all these cues might feel quite different.
Yes.
I know for me, they feel different. Most of my patients would report that too.
Definitely.
Yeah.
And it shows why patients really need to invest in doing these, because they're not things that you do unless you're focusing on doing them, are they?
Yeah, yeah. Someone says this is exhausting.
Yeah. I would agree.
Oh, we've only been holding for a few 1 second. Okay. I've got two more different cues. So we're going to imagine like a tissue box.
Yeah.
I'm going to get you all to take a big breath in. As you breathe out, I want you to visualize your vaginal area, grabbing a tissue from a tissue box and pulling it out, and then let go. All right, one last one. We're going to imagine an elevator or a lift. Okay, so I want everyone to take a big breath in, relax everything first. And then as you exhale, shut the doors on the elevator, and I'm going to lift right up to the top level as strong as you can, and then relax the whole way back down. All right, so I've gone through, I don't know how many cues, I think let's just say 6 cues there.
Yep.
More than that.
More.
Now
Yep.
what I want everyone to do is think about a cue that worked best for you, okay? Because what I'm going to do for the next ones is I'm just going to say squeeze on and then off, but you're going to use the cue that worked best for you, okay?
Excellent.
So now you've found the cue that works best for you, when we do our pelvic floor exercises, we want to make sure there's a strength component, and then there's an endurance component, and then there's a coordination component. Yeah. So your pelvic floor is made up of muscle that's similar to the rest of your body. So we need to train it in a similar way to the rest of our body. Okay. So with our strength principles, generally we want to hold as strong as we can for as long as we can, which generally, if you look at, little handouts people give, it's about 10 seconds. And then we get people to do it about 10 times. So let's just say everyone can squeeze for that long. Well, I'm going to go through 10 seconds, 10 times. You're going to do it with me. So I want everyone to keep their stomach muscles relaxed, bottom muscles relaxed. Just start with a few big breaths again, keeping everything relaxed. We're going to take a big breath in. And then as you breathe out, squeeze as strong as you can, holding for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and then release. We're going to release for 4 seconds and then take a big breath in. Breathing out, squeeze as strong as you can again. If you lose it, I'm starting to count right now. If you lose it, that's fine. Just keep re-squeezing back up, okay? And 3, 2, 1, release. Good, so 4 seconds to relax. Take a big breath in again. Exhale, squeeze as strong as you can for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and release. Relaxing for 4, 3, 2, 1. Inhale to repair. Exhale, squeezing up again as strong as you can for 10, 9, 8. Keep going. If you lose it, re-squeeze, okay? So you might need to re-squeeze as we're going along with 10. 3, 2, 1, release. Relax for 4, 3, 2, 1. Inhale. Exhale, squeeze and lift. Holding for 10, 9. Keep going. Make sure you keep breathing. So I'm talking while I'm holding, okay? So if anyone's at home, make sure that they're not by the end of it letting go. Say inhale. Good. 2, 1, release. All right, 5 more to go. Inhale to prepare. Exhale, squeeze as strong as you can for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and release. Relax for a few more seconds. Inhale. Exhale, squeeze again as strong as you can. If you've lost it at this point, that's fine. Just try and hold on, even if you're holding for 3 seconds. Good. 2, 1, release. We've got 3 more to go. Inhale. Exhale, squeeze and lift. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and release. Make sure you're completely relaxed. Inhale again. 2 more to go. Exhale as strong as you can, holding up for 10, 9, 8, 7. Re-squeeze if you need to. Good. 3, 2, 1, and release. And we've got one last one. Inhale. Exhale, squeeze as strong as you can for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and relax. Okay, really good job. I've got to say, as much as I'm a pelvic floor physio, I don't do my pelvic floor exercises as often as I do. And it actually is really in terms of motivation to do that, because as most patients would understand, and as me even trying to do it now, it's easy to get kind of halfway through and just get a little bit bored with it.
Absolutely.
What I really recommend is there's an app called Squeezy. It was developed by the NHS. It costs about $3, I think.
Great.
Worth the investment. It has like a generic 10 seconds, 10 times, 10 quick lifts, a longer 30-second hold. And all you've got to do is go in and press play, and you sit there and it has this like visual drop going up and down and a wheel that counts. And then there's a section on it which you press healthcare professional. So what you can do is you can adjust it based on like what someone like myself prescribes them. So it might be 6 seconds on, 5 seconds off, 8 times, like that. Right. So that's really good. And it has a little reminder button as well.
You can see how the muscles fatigue. Sorry, dropped an earpod. From people who are, you know, not used to doing them. You can see how it's actually quite tiring, like using any other muscle. And it's easy just to say, I'm done halfway, but persistence is obviously really, really important.
Yeah, it is. And like from what I see, obviously I'm assessing people all the time. It works. If you do it religiously, you know, you're going to see results. It generally takes about 6 to 8 weeks of doing exercises to notice the strength differences. Yeah. So you just got to make sure you stick with it. Someone said KPFE. Yeah, I know which one that is. That's another really good app and it's free. Yeah.
Great.
Yeah.
Excellent. So when should women start doing their pelvic floor exercises? Should women who aren't even pregnant yet and thinking about having a baby be starting now?
Yes, they should. So I think the reason people have this idea that people only need to do pelvic floor exercises after they've had a baby is because most people don't have their attention drawn to that area unless they've had an issue in that area, which generally tends to be the first time after childbirth. Yeah. So everyone should be doing it to keep the pelvic floor strong, but also not just strong, just functional. Like it should be able to go on, it should be able to go off. They should have a normal resting tone. Otherwise, you can end up with an array of issues.
Definitely. And for women who sort of say, you know, my life is really busy, I'm looking after a newborn, I don't have time to do it. It seems to me that pelvic floor exercises are things that can sort of be done while you're doing other things as well. So if you're in the car driving somewhere, or, you know, you're at home just sitting on the couch watching TV, I'm sure you can do it at that sort of time. So it can be sort of weaved into the rest of your life in some way, I'm sure.
Yeah, and so pretty much with your pelvic floor exercises, like generally when you've been assessed by a pelvic floor physio, we grade your strength out of 5. If someone's less than a grade 3, they generally need to be doing their pelvic floor exercises lying down. But if someone's got grade 3 strength, which generally means they're continent, and they should be doing it upright, because you want gravity, and you want gravity to help give you some resistance. And so you should be doing it in a seated position or a standing position, or even walking if you can. And that's to help obviously challenge it a bit further and just make it more functional. I normally tell my patients, so you should be doing it 3 times a day. And I'll normally tell my patients, don't leave it to chance. Actually pick 3 things in your day and do it during those things. So it might be cleaning your teeth in the morning, cleaning your teeth at night, and then, I don't know, on the way to work in the car or something like that.
Great advice. Excellent. And do the type of pelvic floor exercises ever need to change, you know, pre-delivery versus postpartum? Once a woman's had a baby, do you get them to, you know, restart slowly when they start doing them again, or can they go back to what they were doing before they had their baby even? And how, I know you said before, you know, within a few days of birth, women can be doing their pelvic floor exercises again, but is there an optimal time to start doing them after a baby's been born?
Yeah, so let's just assume that most people, when they're pregnant, can hit that 10 seconds 10 times, which is the strength, and then the 10 quick lifts. After they've had a baby, I want them to be doing the strength and the quick lifts as well. But what you'll do is you'll kind of, once you know your pelvic floor, you'll know how long you can hold before it fatigues. So you'll start with how long you can hold for. It might be 2-3 seconds.
Right.
I would assume, if I'm assessing someone at their 6-week check, they can probably on average hold for like 3 to 8 seconds. So that's probably your expectation, but you'd be wanting to aim to get back to your 10-second hold 10 times. And the 10 quick lifts, just to add, the 10 quick lifts does not make you strong. It makes your pelvic floor responsive, so that when you cough and sneeze, it goes on like that, and you don't have to go, oh, I'm about to sneeze, sit down, cross my legs, and then, because by the time you've done that, you've already sneezed, etc.
Absolutely, definitely. And someone's just asking over here, obviously, you know, we talk about being able to contract the pelvic floor, but they've heard that it's also important to be able to relax the pelvic floor completely. How can that be achieved?
Yeah, so firstly, it all comes down to having an awareness of the area. So like the type of patients that I'll see that have an overactive pelvic floor are generally will store quite a lot of tension in that area. So for example, I store tension in my shoulders, in my head, and I'll be like this if I'm stressed. There's the other type of person. There's the other type of person who squeezes their stomach and their pelvic floor. Some do both. But kind of firstly being aware of that. Normally I'll give someone down training exercises. So what they'll be doing is they might go on for 1 second, but then they're actually practicing switching off before they switch back on. But what I'll also do, so they'll be practicing, let's just say I give them that to do twice a day. The one thing that they need to break the habit of is their style of breathing, which will help normalize their resting tone. So with breathing, if someone breathes quite shallow up through here, and you can tell if someone's doing that, people generally breathe that way if they're stressed or they're rushing and things like that. That's the habit that people need to break to be able to relax their pelvic floor. You need to kind of transition yourself back into a belly breath, because when your belly's relaxed and kind of going in and out when you're breathing, your pelvic floor is going down and up when you're breathing too, rather than holding rigid. So normally I'll teach someone how to belly breathe, and then I'll get them to put a reminder on their phone every hour. Every time it goes off, they have to cue in, think what their pelvic floor is doing. If they're switched on, which they probably are, then they've got to relax, and then they've got to do like 5 breaths just to restart themselves. It's a hard habit to break. It probably takes, I'd say it takes about 2 to 4 weeks for someone doing it to actually get into the habit of breaking it. Yeah.
Excellent. Jess, another question that I really want to ask you tonight is something that I get asked very, very often as an obstetrician. And to be honest, I think I'm being asked this question with an increasing frequency each year that I'm in practice. And that is from women who come to see me, and very early on in their pregnancy even, they want to know about the impact of different types of delivery on their long-term risk of pelvic floor dysfunction, incontinence and prolapse. And I think a lot of women are of the understanding that a vaginal delivery is far worse in terms of what it means. But some women sort of come in thinking that if they request a caesarean section, which some women do, and I'm very much pro-choice as an obstetrician and happy to support whatever it is that is the right option for any particular woman and their family. But a lot of women, I think that they believe that having a caesarean section will completely nullify their risk of any pelvic floor dysfunction. I certainly know what I think about that, and I'm happy to sort of add to whatever you have to say shortly. But as a pelvic floor specialist, what is your take on that sort of line of thinking?
Yeah, so when I get asked this every single day, and I'll tell my patients, the female body is designed to give birth vaginally, firstly. Mm-hmm. So the muscles are designed to stretch, designed to go back. But what the evidence says is that pregnancy itself in the longer term, so for someone who's in the menopause, is the risk factor. And when you get to, and regardless of your mode of delivery, whether it's cesarean or vaginal birth, when you get to the menopause, it doesn't matter what mode of delivery, but pregnancy itself is the risk factor for anything such as prolapse or urinary incontinence, leakage, etc. And then I suppose this all comes down to the advice I think you're given around the delivery itself, in terms of making sure that the perineal care, which we talked about earlier, and having a really good team, obstetrician, midwife, who is doing the things like you said, in terms of slowing down a baby's head as it's coming out, using the warm compress, avoiding episiotomy if it's not needed, etc. Because those things on the side, which we've talked about previously, in terms of your bigger baby, longer pushing stage, etc., are the things that will put you at more risk of having pelvic floor issues later in life as well. Yes. So those things are modifiable, and they're the things that you and I would be approaching before they give birth, and kind of if they did have those issues, that's why we see a pelvic floor physio as soon as possible to rehab.
Absolutely. I completely agree with everything you've said. And I think that vaginal delivery in the short term certainly confers a higher risk of, short-term incontinence and prolapse over women who have an elective caesarean section. But pregnancy in itself is the greatest risk factor for pelvic floor dysfunction. But again, it's about individualizing care. And that's why, certainly in my private practice, I get to know my patients from the beginning of the pregnancy right through. I know about different risk factors like the size of their baby, and when it comes down to controlling the delivery and make sure that they don't have a prolonged second stage or, unnecessary instrumentals and those sorts of things, I think that enables us to, as a team, give them the best outcome. But there are certainly some women for whom elective Caesars are the preferred mode of delivery. And as I say, I've got no issue with that whatsoever if that's what a woman wants. I have plenty of patients that request elective Caesars. And as I say, that's completely fine. But for women who come in saying, I'm going to have a Caesar because I don't want any pelvic floor dysfunction, I always think it's really important for me to say, look, it may slightly protect you, but being pregnant in itself is a risk factor for pelvic floor dysfunction. And it's really important that you therefore still engage in the same pelvic floor exercises and pelvic care that anyone planning for a vaginal delivery does as well.
Yes, so you do need to do your pelvic floor exercises even if it's a cesarean.
Correct. That's a summary of what I'm trying to say. So I completely agree with that. The last thing I want to touch on tonight is we've spoken about sort of what we can do to prevent pelvic floor dysfunction, but there are obviously women that you see who come with problematic incontinence or prolapse, and how does your care differ for these women? So if you've got a woman who is 6 weeks or 6 months postpartum who comes to you saying, every time I cough or sneeze, I'm leaking, I feel this real bulge in my vagina, what are you going to do differently for these women?
Yeah. So I suppose the good thing is when I'll see someone at 6 weeks postnatal, I'm always encouraging to them that even though you've got these symptoms now, it's really good that you've come this early because your body's still healing. So we can kind of catch you in that phase and help things improve. Obviously I'll start people on pelvic floor exercises. I'll make sure they're doing it right. Depending on how strong someone is, we might consider potentially using like an electrical stimulation device. If someone's quite weak, just kind of restart things. And we might consider even use of like a short-term pessary, which is like a little ring. That's one of them that goes in and kind of holds everything up to help everything go back to where it was. And then also giving advice in terms of, it's quite common postnatal for someone to have issues with their bowels, you know, being constipated, things like that. If someone's got issues with their bowels in pelvic floor world, the number one rule is fix the bowels and it fixes the bladder. So I'll always be addressing the bowels, and then after that I'll address generally how much exercise they're doing. So it kind of goes both ends of the spectrum. So someone who's postnatal, you know, there's the mum who is desperate to get back to the pre-baby weight and will be going on long walks from a few days after giving birth. That needs to be addressed, because essentially you should be resting as much in the first 6 weeks. You know, you've essentially had surgery. You want to make sure everything goes back and recovers. So I'm a big advocate of, I don't know if you've heard of the book, The First 40 Days.
Yes.
Yeah. So it's based on, you know, Eastern medicine and things like that. But essentially it's, you want to rest and do as little as possible the first 6 weeks. I advocate for that. So I'll kind of pull people back if they're doing too much exercise. I would expect at 6 weeks, you could walk for 30 minutes. So giving them that guideline. And then on the other end of the spectrum, someone might just be really low tone and not be doing enough. So then I might actually increase their exercise and give them just like general exercise, you know, squats and maybe a bit of Pilates and things like that. I'm a huge advocate of Pilates because I think, because it's clinical, if someone comes to me and they've got back pain and pelvic pain and sore shoulders from holding a baby and pelvic floor issues, they can address all those things in a Pilates session. So that's kind of my advice surrounding those women that might be different to someone who's not in that immediate postnatal period.
Brilliant. And I think there are some who have really severe pelvic floor issues, like, you know, marked prolapse after a number of kids or incontinence. And, you know, these are women who sometimes do need the expert care of a urogynecologist. I don't do that in my practice. I focus only on obstetrics. But, you know, I think that for women, there are some women that will need surgery down the track to correct pelvic floor issues. I think that that's something that we often try to avoid until a family's completely finished. Because if you go through surgery and then have another kid, you're likely to, you know, do a lot of damage again to something that you've gone through a lot of effort, you know, to have fixed. So I normally say to women, finish your family, and then that can be addressed more definitively down the track. But, you know, that's not something in isolation, and that's done in collaboration with, you know, experts like yourself as well. There's a question here that I'll just ask you as well. What are your thoughts on using dilators? So I know that some obstetricians recommend things like the Epino, which is sort of a dilator that is used for weeks pre-delivery to reduce the risk of tearing. But what's your take on what it actually is doing to the pelvic floor? Is it something that you're happy for your patients to use, or do you prefer perineal massage?
Yeah, so I do get asked this a lot. I think I prefer to be evidence-based. Perineal massage has good evidence. It's free. It's easy to do. Look, the Epino, it's a newish thing. There's not that much like longitudinal studies on it. You know, the pelvic floor is meant to stretch that much only once. I don't advocate for someone really stretching their pelvic floor to 9 centimeters multiple times before, because, you know, it could lead to prolapse risk and things like that.
Agreed. Yeah.
But if someone has one, I will give them safer instructions on how to use it.
Yeah.
But I don't not routinely advise someone to get one.
Perfect summary. I couldn't agree more. Excellent. The very last question I'm going to ask you, because we're almost out of time, is someone who's asked tonight about women who have pelvic floor dysfunction before they even embark upon pregnancy. And I think that these women who are, very anxious about, making things a lot worse with pregnancies. Do you ever do sort of consultations pre-pregnancy, so before women even try to conceive, and if so, for women who have issues, what sort of things can you address at this very early point in their pregnancy and parenthood journey?
Yeah, so I'd say the number one thing someone is talking about when they're worried because they have bladder issues already is generally they have a bit of an overactive bladder and they're going to the toilet all the time. And these people always come in and they say, I've got a really weak pelvic floor. Well, actually, what I'll normally find with these patients is they have a really overactive pelvic floor and they have sensitivity around the area. So that's the reason they're feeling their bladder at smaller volumes and, maybe not emptying properly. But the other thing is it generally develops from poor bladder habits. So there is a bit of a psychological component of it, and it actually, like bladder retraining, which is what physios do in terms of retraining your bladder back to normal habits, is really, really good and works really, really well. So even if someone has issues like that and feels like they're going to the toilet all the time and gets pregnant, it's not too late to do something straight away early in pregnancy. Yeah.
Excellent. Fantastic, Jess. Well, I think that is an incredibly brilliant summary of what women can and should be doing to look after their pelvic health. I am a huge advocate of collaborating with physios who specialise in this area in pregnancy. I think that it is an incredibly important part of prenatal and postpartum care. So for women who are wanting to access your expertise, what's the best way for them to be able to do that?
Yeah, so I would most likely say to go on my website. There's an instant booking link for 2 clinics that I work at, or feel free to shoot me an email. I think my email is on my Instagram, or just send me a message. Send you down the right route to book in.
Brilliant. And I'll make sure that this video is saved. I'm very happy for you to reshare it as well. And I will tag you in it as well, so anyone can access you that way. But thank you so much for your time tonight. I really appreciate it. I think this has been an incredibly practical, pragmatic summary of what women should be doing. And I think a lot of people are going to spend 10 minutes in bed tonight doing their pelvic floor exercises or in the car on the way to work tomorrow morning. But really, really appreciate your time this evening. And hopefully you'll see a lot of my patients over the coming weeks, months and years.
Thanks so much, Scott.
My greatest pleasure, Jess. Take care. See you later. Bye. Bye.